Hello, my name is Brooklyn Jenkins, and I am going to be demonstrating how to find the landmarks in the injection sites for a intradermal, a subcutaneous, and an intramuscular injection. I have done a separate video on the injection process itself, so this is a video on just showing the landmarks in the injection sites. So to start, I'm going to demonstrate the subcutaneous injection sites. So I would be injecting into the subcutaneous tissue, which is the adipose tissue or the fatty tissue that is located just below the skin but above the muscle layer. So the best sites for that would be, stand here for me, on the abdomen below the costal margin, and I would want to stay at least 2 inches away from the belly button. So here on the abdomen, as well as the interior portion of the thigh, the outer portion of the upper arm here. So I could do this side or this side, and then I could do the upper portion of the back, or I could do the upper portion of the dorsal gluteal. And then for intradermal injections, I would be injecting below the epidermis into the dermis layer of skin. So those would be onto the inner portion of the forearms, as well as the upper chest here, and on the back below the scapula. And then the last sites would be the intramuscular. And so for those, I would want to inject into the muscle layer itself, so below the skin and below the fatty tissue. So for those, I could inject into the deltoid, which I would locate the acromion process for, do 3 finger whisks below, form an inverted triangle, and then I would want to inject into the very center of that triangle. I could do the vastus lateralis, which I would locate by creating an imaginary grid on the patient's leg, dividing it into thirds vertically as well as horizontally. So for that, I would want to inject into the vastus lateralis here, which is the outer middle third of the leg. And then the last one would be the ventral gluteal site. So if you want to move your arm for me, babe. I would want to inject it here into the ventral gluteal muscle. So I would start by locating the patient's iliac crest, place my palm on their greater trochanter, and then I'm going to rotate my index finger towards the anterior iliac spine, and then I would give the injection in between my pointer and middle finger there. So that is how I would find the injection sites for an intramuscular, a subcutaneous, and an intradermal injection. Thank you. Hello, my name is Brooklyn Jenkins, and today I'm going to be doing the skills for an intradermal injection, a subcutaneous injection, as well as an intramuscular injection. Before I begin, I just want to state that I will be doing all the steps prior to finding a landmark in this video, as well as all the steps after, but I have done a separate video for assessing a landmark on a patient. So to start, I would follow all GPSP guidelines. I would complete my 11 medication administration rights, as well as my 3 checks. So the first step would be to knock, and well, actually it would be to gather all of my supplies prior to entering the room. So I have prepared my syringes, I have prepared my alcohol swab, my gauze, everything that I would need to administer the medication. I would then knock and greet the patient, identify myself as the nurse, identify my patient using 2 identifiers, and then I would assess them for allergies, and then complete any assessments necessary prior to beginning the medication administration, as well as, although I prepared my supplies before entering the room, I would also prepare my supplies that I have them easily accessible before beginning the administration of the medication. So I'm going to perform hand hygiene and then don gloves. So I'm going to be performing all 3 injections, and then I will complete the steps following the injections after only one time. That way I can show without having to repeat all of the steps several times. So I would begin by cleaning the area with an alcohol swab, starting in the center and working outward in a circular motion. I would then allow that to completely air dry, and then I am going to take my syringe with the medication, and I am going to uncap the needle, and then I would inject the needle at a 90-degree angle, stabilizing with my non-dominant hand, and inject the medication slowly And then I'm going to remove my non-dominant hand and pull out the needle at the same angle it was inserted, and then engage my safety device and apply pressure to the site. And then I would bandage this and then repeat the steps that I will show later. So same thing for a subcutaneous injection, which is going to be at a 45 to 90 degree angle. I'm going to clean with an alcohol swab in a circular motion, allow that to air dry, and then I'm going to take my needle and uncap it in the OK position, and then I am going to inject this at a 45 degree angle, and I am going to stabilize it with my non-dominant hand, inject the medication slowly, remove at the same angle it was inserted, apply pressure with my non-dominant hand as I'm engaging the safety device with my dominant hand, and then apply pressure to the wound. And then same steps for the next. This would be an intradermal, so I'm going to inject this at a 5 to 15 degree angle. I'm going to cleanse the site in an outward motion with alcohol, and then going to uncap the needle in the OK position, and then I would angle this at a 5 to 15 degree angle with my dominant hand, stabilize with my non-dominant hand, inject the medication slowly, and then begin removing the needle and cover with a piece of gauze with my non-dominant hand, engage the safety device with my dominant hand, and then I would apply pressure. After the site has stopped bleeding, I would cover with tape or a bandage, and then I would remove my gloves. I would report and record in the patient's chart that I have administered the medication. I'm applying hand hygiene as well right now, but I would report and record after that, and then I would perform an evaluation in the appropriate time frame based on the medication I have administered to my patient. Thank you.